monkeypox virus is a type of a
Hmm.
orthopox virus family, from where we had smallpox, variola, cowpox,
Hmm.
horsepox, squirrel pox, rat pox, Alaska pox, and
Hmm.
monkeypox was there in monkeys in Africa, particularly Central Aids Belt of Africa. Around 1958,
Hmm.
this case of monkeypox was diagnosed. When you describe this as STI, then your focus goes on
Hmm.
the sexually active people and those who are indulging in higher sexual activity like sex workers, male sex with male or trans, then you can focus on them.
Hello and welcome to this special broadcast on One India News. This is me, Ansh Pandey. Today morning, viewers, the World Health Organization again declared monkeypox a global health emergency and a major concern for the world. If we talk of it right now, many cases are being reported in Europe, South Africa, and even in our neighborhood, that is Pakistan. But is that a concern for India? For that to talk, we have got Dr. Ishwar Gilada with us, who is a very known voice in India for fighting the AIDS, the major disease. He's also the president of the AIDS Society of India. Dr. Gilada, welcome for this interview regarding the monkeypox.
Thank you. Thank you very much.
Uh, thank, Surely you're welcome, sir. Sir, without wasting time, I would like to ask first major question. Sir, what exactly is this monkeypox virus, and what exactly are the symptoms and the cause of origin? Can you shed a little light upon that?
You see, monkeypox virus is a type of a
Hmm.
orthopox virus family, from where we had smallpox, variola, cowpox,
Hmm.
horsepox, squirrel pox, rat pox, Alaska pox. And
Hmm.
monkeypox was there in monkeys in Africa, particularly Central Aids Belt of Africa. Around 1958,
Hmm.
this case of monkeypox was diagnosed. When it is in monkeys, it is monkeypox. But when it was transmitted from the monkeys to human being, that was around
Hmm.
1970 in DRC Congo, which was that time called Congo or Zaire. Country name was Zaire. Then it got
Okay.
divided into two countries. DRC Congo is
Hmm.
Democratic Republic of Congo, and second Congo is called Brazza Congo. So in DRC
Hmm.
Congo, on the that river belt of Congo River, this was commonly found. Thereafter, it was endemic. Endemic means only in that part of world only. And then it became
Hmm.
also endemic to some Western African countries. That was Senegal, Dakar. That Dakar is the capital of Senegal, or Chad,
Hmm.
Nigeria, those countries. And also it was endemic there. When it went out from there in around 22, in 2022, around May, it went to some of the countries in Western Asia, Western
Hmm.
Europe and America and Australia and New
Right.
Zealand and Canada. That time it was
Hmm.
found that it is no more a endemic country, endemic to those particularly African country. It was spreading everywhere. And that was a clade
Hmm.
2 virus, which was from Western Africa, not clade 1. So clade 2 is more infectious and it was less lethal, means killing less people but infecting more people, just like Omicron,
Okay.
if we compare that with
Just like
Omicron.
Omicron virus.
Yeah.
Hmm.
And then around uh, July, in July, I think, 22, the WHO declared this is a emergency for the public health emergency of international concern, PHEIC. And
Hmm.
thereafter, couple of months, it went on increasing, then it got controlled, and by May 2023, WHO declared this as it is no more emergency. So that emergency title was withdrawn. So for
Okay.
last 1.5 year, we have been like there is no emergency. Now again it started spreading, but it is in the Congo area, DRC Congo area, and clade 1B type of virus. Clade 1 was a virus which was endemic. Clade 1B,
Hmm.
it got into other countries also, at least four countries, and that is Uganda, Burundi, Rwanda, and Kenya. So currently it is in
Okay.
five countries in bigger number. In the other four countries, there are more than 100 cases were there. and there are around 538 deaths in Congo area,
Mm-hmm.
DRC Congo area. Now we got one case in Pakistan, one case in Sweden, a couple of cases in South Africa. So it is now growing from there. And good thing that the WHO has declared this as a public health emergency of international concern, because initially we thought it will be regional only in Africa. Why international? But now it is
Mm-hmm.
also out of Africa. Sweden is
Mm-hmm.
a Scandinavian country. Pakistan is part of Asia. So
Mm-hmm.
Pakistan's patient's history is that the patient traveled to Saudi Arabia. But Sweden patient's history is
Okay.
patient traveled to Africa. Now, when people travel there, so only travel history is not helpful. We need to involve the history which is related to sexuality, because
Mm-hmm.
the uh, clade 2 virus, which was spreading all over the world, and totally 90,000, currently 98,000 cases are there, 99,000 cases are there, totally
Mm-hmm.
99% of them are male sex with male, 1% are
Okay.
female, and hardly one or two
Mm-hmm.
children. So it was and this is between the age group of 20 to 40.
Mm-hmm.
Now, why so? Because in 1988-89, smallpox vaccination was withdrawn because nobody was getting smallpox. So those people who
Mm-hmm.
got smallpox, they are immune to monkeypox. Now, monkeypox
Okay.
creates a problem in people's mindset that people are doing monkey tricks and therefore they are getting monkeypox. So I requested even in 2022 that please do not call
Mm-hmm.
it monkeypox because it is not spread from monkeys. It may have spread at
Mm-hmm.
the time in 1970. After that, the monkeys, uh, it is being spread through dormice or squirrels or some other animals or domestic or kind of forest animals, but not through monkeys. So we should not call monkeypox. So they should reduce it to mpox.
Mpox.
Mpox can be in mind monkeypox. It can be male pox because only males are getting, or male sex with male pox.
Mm-hmm.
I don't know what is a mpox meaning, but it is mpox. So currently we do
Mm-hmm.
not call it monkeypox. We call it mpox. So
Mpox.
stigma and discrimination reduces. Secondly, I describe this as a 21st sexually transmitted disease of 21st century. Till
Okay.
21st century, we had only 20 infections. Now this is the 21st infection. But somehow it is not described as STI. I don't know why. When you describe this as STI, then your focus goes
Mm-hmm.
on the sexually active people and those who are indulging in higher sexual activity, like sex workers, male sex with male or trans. Then you can focus on them. I do not say that you stigmatize them, but you prioritize them.
Mm-hmm.
So your action to act or prevent is there. The second issue is that if you do not call it STI, then you keep on talking about HIV control by doing pre-exposure prophylaxis, post-exposure prophylaxis. But by doing that, it is in addition to condom, but we don't say that. So if you don't use condom, you prevent HIV by taking those medicines, but you get other STDs.
Mm-hmm.
And that's how in last 10 years, other STDs have increased. Gonorrhea, chlamydia, herpes, HPV, syphilis, they are increasing. And if they are
Mm-hmm.
increasing, then one more disease is added. And lastly, is the zoonotic infection. Zoonotic means in last 40 years, we are seeing most of the infections are new infections are viral
Mm-hmm.
infections. And of them, more than 40% are zoonotic means coming from animal. And so
Okay.
they are Ebola, Zika, Nipah, HIV, SARS, then even the COVID virus that came from bats, now the monkeypox or mpox. So they are all coming from animal. And this is the reason
Mm-hmm.
where human beings, for their own survival, they start eating any kind of flesh, whether it's a domestic animal or forest animals, or they are
Mm-hmm.
intruding into atmosphere of those animals and they pick up those infection from there, and then from there it get transmitted to other human beings. And that is a big problem where we cannot be selfish. We have to live and let live.
Mm-hmm.
Symbiosis means you also survive, we also survive. If for your
Mm-hmm.
survival you want to kill somebody, then you get into problem. And that's how his ecology is also disturbed in the world. That everywhere we are going and we are building buildings, concrete, in forest,
Hmm.
in hills, in everywhere. Then we get into problem. Same thing happened in Wayanad. So these two issues, ecology and going in the domain of other animals, other plants, or other insects, we are creating problem for ourselves. We should not intrude in others' atmosphere.
So more or less, we should not, I mean, we should not get indulged with them that much, and we should have their own space. Mr. Gilada, another question. World Health Organization declared it as an health emergency. We got two or three, as reported by the media of Pakistan, cases there. But sir, regarding India, how do you believe that what could be the situation in India, and can it get worse here?
You see, it is a matter of time which will tell. But India is not
Hmm.
different than Pakistan geographically and in human behavior. So we cannot say
Hmm.
that just like in cricket, oh, India jeet gaya, Pakistan har gaya, Pakistan it's not like that. It
Hmm.
is only incidentally it is noted in Pakistan. It may be in India. If we test some people, we will find out. Your other question was how do we find out? There are three things. Number one, the
Hmm.
history of the person, whether the person is indulging in sexuality, male to male, in multiple
Hmm.
places without condom. Number two, if your person is getting fever, kind of skin pox marks, or some kind of ulcers or wounds, which are on may not be in sexual area. It can be on face and hand also. Then lethargy, body ache, then lymph node enlargement, lymph gland become bigger, and then some people get systemic infection where respiratory attack is involved. You get into
Hmm.
the ARDS, that is acute respiratory distress syndrome. You can die. So in current scenario in Africa cases, 4.7% is a death rate. So whatever number of people are getting infected, 4.7 people percent have died. And overall, in last 2 years, whatever cases are seen, death rate is between 0 to 10%. In some places, high death rate, in some places, low death rate. So, but it is not as lethal as Ebola, Nika, Zika. So we need to be watchful. We need to keep on doing the study. So how do we find out history of the person? Secondly, whether the person is having any kind of these symptoms. And thirdly, if
Hmm.
we are able to do Mpox test, PCR test, if that test is positive.
Okay. Mr. Gilada, when we talk of coronavirus, COVID-19, and then monkeypox situation, I mean, if we draw parallels between the both of these health concerns, so what exactly is the striking difference between two? I mean, you have already told that, but sir, is monkeypox more lethal than COVID-19 as of now, as you told about the more death rate? But I think that's still higher than COVID-19 right now.
See, we cannot compare COVID and Mpox for two reasons.
Okay.
Mpox is
Hmm.
transmitted through sexual contacts, with
Hmm.
intimate body contacts, whereas COVID was transmitted through droplet infection, surface transmission, through
Hmm.
cough, through aerosols, which is not the case with Mpox. So
Okay.
in COVID, the infection was magnanimous because you travel in public transport, you travel in train, you are going in market, you going to the hospital, you go to school, you pick up infection from anywhere. Mpox is limited to 20 to 45 years of age because above
Hmm.
45, the people are vaccinated by smallpox, they are immune to getting this Mpox. Number two, it is only through sexual activity. So becomes limited. It is not to
Hmm.
every children or old people or everybody is going to get. So in
Hmm.
COVID, what happened? If it is infecting any age group, then people who are above the 60, who are comorbidities, uncontrolled diabetes, renal problem, they were at more risk. Here, that case is not there. And therefore, we
Okay.
need to have a different strategy here. And I suggested that Mpox should be handled, managed, prevented only through NACO, National AIDS Control Organization. Because NACO has got a good equation with community groups of MSM, male sex with male, or trans population, or sex worker population. The intervention projects are there.
Hmm.
You need to add only one component that will prevent Mpox. But if you give it to a new agency, new organization, you are creating whole awareness in the whole country of over 1.4 billion people, 140 crore people. It is not required.
Right. Mm-hmm. Uh, Mr. Gilada, just one more last question. This is regarding the health system. I mean, that's a very great thing that monkeypox is not such a virus that can spread like COVID-19. But at one point of time, when it was happening, when the COVID-19 virus was spreading, it was also believed that it is not going to spread into human with that speed. What happened with the Delta, then after even Omicron. Uh, if I'm taking the worst case here, if monkeypox spreads like that, it somehow gets airborne or like the aerosols you told about. So, is the Indian medical infrastructure ready to handle another pandemic? What's your take, Samada? I'm not sure about that, but I want to know your take on this.
Yeah, you see, basically, that is called pandemic preparedness. Pandemic
Mm-hmm.
preparedness doesn't wait for some new disease to come, and then we decide whether we need to do something. You need to have well before you get thirst. बोलते हैं ना,
Mm-hmm.
प्यास लगने के पहले पानी रेडी चाहिए, प्यास लगने के बाद में आप कुआं खोदो
Mm-hmm.
तो काम नहीं चलेगा. So your pandemic preparedness says that you be prepared whether A disease come, B disease come, C disease come, or if any natural catastrophe come, cyclone come, you're prepared. What is that preparedness? You need human manpower, doctors, nurses, technicians, what was Aya. Number two, you need beds, ICU, ventilator. So if somebody needs bed, bed should be available. If somebody is sick, sicker than other people, should be sent to ICU. If patient is cannot breathe, we are able to put ventilator. All these three
Mm-hmm.
things were in short supply prior to COVID, particularly before Delta wave. Now we know
Mm-hmm.
how we are prepared for that. That our preparedness can be used for any disease. And thirdly, our capacity to do research, to track the virus, whether it is a clade A, clade B, that was, if you talk about this PCR lab or genome sequencing lab, there were hardly 3, 4 labs before COVID. Then after we had more than 10,000 labs doing PCR test. We are now 30, 40 labs which can do genome sequencing. So we are definitely on all front better prepared. But it doesn't mean that you have a helmet and you have a bike, and because helmet will not allow you to get a head injury, आप मौत के कुएं में गाड़ी चलाओ. Understand?
You'll
We are
still get
prepared.
injured.
We're prepared,
Mm-hmm.
but we don't want to poke in. So
Mm-hmm.
when we are prepared, it doesn't mean that we invite infections. We can
Mm-hmm.
prevent infection, we can control. We cannot invite infection, and some infections are being invited by human beings because of intrusion into the animal atmosphere. And that we need to look at, because mad cow disease or bird flu or SARS, how did it come? Avian influenza, how did it come? They come from the animal. So then
Straight from
once
animals.
it come from animal, then you kill the animal, you kill the cows, you kill. Why you intrude others' atmosphere?
Hmm.
Let them live, you also live. Only then there will be symbiotic relationship in world, and world can go on properly. If we try to poke in another's atmosphere, they are going to create problem for you. Because sometimes we human beings think that we are extra smart, over smart, and we also have
Hmm.
our intelligence, and as well as artificial intelligence, we can overcome everybody in the world. That is a we are in fool's paradise. Everybody is intelligent. All animals are intelligent. All viruses are extra intelligent. They can also ruin us. We have seen that.
Uh, well, Mr. Gilada, once again, thank you for this special space, this time for yours, for this interview, because many viewers and even from today morning, there was kind of a debate around the social media that another pandemic is coming, another pandemic is coming. So we decided for this interview, and most of us thought that no one can be better than you to talk about this. So once again, sir, thank you, and we hope that monkeypox situation doesn't goes out of hand, just like the COVID-19 and other pandemic situations. But sir, once again, a big thank you for this special space and this exclusive talk, sir. Thank you.
Thank you, Amish. Thank you.